Hi, we're Team 27, and our Capstone project is designing an endovascular shunt for treating hydrocephalus. So this is our team, and Andrea is going to tell you a little bit more about what hydrocephalus is.
Our problem that we're solving right now is hydrocephalus, specifically obstructive hydrocephalus. Hydrocephalus is a buildup of CSF, which is deep within the brain and can cause ventricles to enlarge, as well as an increase of pressure within the brain and can cause damage to its tissue. The users of this product need a shunt to remove this excess CSF and relieve the pressure that it causes. It also needs a less invasive brain pathway for shunt replacement. This will eliminate excess brain damage to its tissue, and then we need a replaceable shunt.
Hydrocephalus can be diagnosed through ultrasound, MRI, CT scans, spinal tap, intracranial pressure monitoring, or fundoscopic examination. It's solved with a shunt, which can be inserted by a doctor, which is a tube that drains fluid from the brain to the chest or abdomen, an endoscopic third ventriculostomy, or a choroid plexus cauterization. However, our proposed solution is an endovascular shunt system, meaning there will be no need for burr holes.
Our first technical model is a laminar flow Navier-Stokes equation because the flow of CSF in the shunt is crucial to the device. The equation looks at the viscosity, pressure gradient, density, and diffusion of CSF, and this will allow us to determine the drainage pathway, shunt position, and the size of the shunt. The other equation we used was volume force, and this is specifically for the proximal end of the catheter, and this uses suction force in order to drain the ventricles. If there's too much suction, that could cause negative side effects to the patient. And if there's too little suction, the patient continues to have hydrocephalus with excess CSF.
So we're using an endovascular approach to relieve this CSF buildup in the aims of minimizing the invasiveness of the procedure. And this does a few things. For one, it reduces the infection rate associated with the procedure, which is one of the biggest problems faced in treating hydrocephalus. Another thing it does is it reduces the risk associated with the procedure and the recovery time, since you won't need a burr hole in the skull, for example. And then lastly, this reduces the amount of long-term complications that the patients might face as a result of the really invasive treatments typically for hydrocephalus.
For 2024, the global hydrocephalus shunt market is estimated at $474 million and is predicted to keep growing at around 4% for the CAGR. North America is the largest area for hydrocephalus shunt markets. Here are references, and thank you for watching.